Hi, I'm Matt Romoser with the Iowa Pork Industry Center, and today I want to talk to you specifically about some gilt management practices centered around estrus synchronization. So, when would producers want to synchronize females and synchronize their estrus cycle? Well, specifically, and the obvious reason would be to tighten the breeding window within a group of females, specifically around batch farrowing would be a prime example from when you'd want to be able to synchronize a group of females. Also, to maximize the number of gilts or sows that would be available to breed for a given period, whether that's gilts or sows that maybe were long in a wean to estrus interval and we need to try to work them back into a breeding group, or we need to be able to have a surplus of gilts available for a specific breeding group in order to be able to meet breed target. Obviously, another option would be to induce estrus into gilts, or as we just stated, an estrus sows, and trying to get those females back in cycling so we can get them bred and minimize non-productive days. So I think in order to really understand the tools that we have available from a synchronization standpoint, everybody can read and follow a protocol that maybe is set forth by a pharmaceutical company. But in order to really help and utilize these tools to maybe troubleshoot some challenges we may have in the breeding herd, I feel it's really beneficial to understand what we're trying to use these tools for and what we're trying to control. So ultimately, we're wanting to control this HPG axis, or the hypothalamic pituitary gonadal axis, right? So the hypothalamus and the anterior pituitary are both structures in the brain that help regulate reproduction and hormones. And then obviously the ovary would be the primary hormone, structure or organ that would be also involved here in controlling reproduction here. So when we start out, obviously, the first thing that it takes place would be the GnRH, or gonadotropin releasing hormone, would be released from the hypothalamus. This ultimately acts on the anterior pituitary and results in a release of follicle stimulating hormone and luteinizing hormone, or FSH and LH, shown here. And these two hormones play an important role in the fact that they act directly on the ovary and result in estrogen production from the recruited follicles here shown on the ovary. So in this stage, the follicle here is shown to still be a small to medium follicle. And right now that's producing enough estrogen that it exerts actually a negative feedback back on the hypothalamus and anterior pituitary. But as that follicle continues to grow, obviously it increases in size. And right before it gets to that pre-ovulatory stage, that estrogen feedback actually becomes a positive feedback on the hypothalamus and anterior pituitary, which then shifts and results in a large surge there of GnRH and LH. And that pre-ovulatory LH surge is really what ultimately ends up causing that follicle to ovulate. And this all happens during that time when that female would be in standing heat. So around this time is when that gilt is most receptive for breeding, and this would be when you would want to inseminate that female in order to be able to get her into production. Obviously, after that follicle would ovulate, the structure then becomes what we call the corpus luteum, and it would obviously undergo luteinization. And the predominant hormone then at this point, as we're in the luteal phase of the estrus cycle, is progesterone. So then the corpus luteum produces progesterone. And again, this produces a negative feedback on the hypothalamus and anterior pituitary. If the gilt or sow after she's bred does not conceive, then ultimately this CL structure would regress off of the ovary. We lose that negative feedback of progesterone, and we're back at the beginning of that cycle. So very quick overview of what we're trying to control here with some of these tools we have from an estrus synchronization standpoint. So one of the primary ones that most folks would be familiar with, specifically from a gilt management standpoint, is going to be what we call PG600. So it's a single injection that we use to induce the estrus behavior. Acts directly on the ovary to stimulate follicular growth, and this is going to mimic those two hormones, FSH and LH. So it acts directly on the ovary, does not initiate ovulation, but it does help with that follicle growth and hopefully to be able to stimulate that estrus behavior, both in prepubertal gilts and estrus wean sows. So gilts or sows that haven't resumed estrus in a timely manner after weaning. Will not work on females that have already cycled. So obviously, if a gilt has already exhibited one heat, she's at some point in her cycle when you would inject PG600, it's not going to have the same effect. or really any effect unless it's timed after day 15 on actually be able to get that gilt to be able to cycle properly. So it's important in this instance to really review your effectiveness of your abort exposure, make sure we're accurately recording any gilts that have already cycled before giving them any sort of an injection such as this, as improper timing of an injection of PG600 could lead to cystic follicles and compromise that gilt's ability in the future. Another common product that we would use here from an estrus synchronization standpoint is going to be Altrenogest. Shown here would be a bottle of Matrix. It's just the trade name here for this particular product. We also have Chronomate and Swine would be other trade name products for a hormone such as this. And this actually acts directly on the brain. So this is a synthetic progesterone. So just as we described there, this works to provide that negative feedback on the structures there in the brain, the hypothalamus and the anterior pituitary, to be able to provide that negative feedback and essentially quiet the reproductive system. So as gilts are fed this for a certain time period, they have to have already reached puberty prior to being fed this. Otherwise, it will not induce heat. Okay, so this is basically, this is a product that's then used to be able to synchronize and be able to get all females within a certain pool at the same stage in their estrus cycle. So if estrus status is unknown, you can then follow up a matrix regimen with a shot of PG600 to be able to induce heat in the event that maybe it's a gilt that you don't know for sure whether she's cyclic or not. So important things to remember as far as Altrenogest dosing. So the standard protocol that's going to be recommended would be 14 days at roughly 7 milliliters per day. So orally administered. And then typically you can expect that female to be able to show estrus 4 to 9 days according to label after that last administration. Some important practices that need to be considered is really precision as far as administration goes when it comes to timing each day, as well as dose volume. So Altrenogest generally can be fully metabolized in the system of the female after 24 hours. Thus, giving it the same time each day is very important in order to be able to restrict that follicular development. Okay, so underdosing can lead to cystic follicles just in the fact that it only provides enough negative feedback to really prevent that growth from medium to large follicles. So because we still want to be able to have some follicular recruitment going on, we just don't want to be able to have those large follicles that can then become cystic, and then that sow won't come into heat following this administration. So we want to make sure we're very consistent both in timing and dose, and if we need to calibrate the dosing device that we use to confirm that we're giving the proper amount each day to those females. So what about timing of Altrenogest administration? Can it be given at any point during the estrus cycle? In short, yes. Since Altrenogest is a progesterone analog, it really just provides the same sort of negative feedback on GnRH release that the corpus luteum would. So we look at stage of estrus cycle. Here looking at immediately after that sow has exhibited estrus. If we started her on Altrenogest shortly after she'd stood, Altrenogest would just coincide with normal CL production of progesterone, and follicle growth would resume after the last treatment. So we would basically just be in line and administrating that hormone, typical to what that gilt's normal hormone cycle would be. We look at it if we start gilts who are in the middle of their cycle. We'd have Altrenogest would just simply delay that follicular development after the CL regresses normally on its own, and then estrus would occur after that last feeding of Altrenogest. And then if we did it immediately right before gilt was expected to come into heat, that Altrenogest would again provide that negative feedback. Those follicles that had started to grow would cease and would be replaced by newly recruited follicles once Altrenogest feeding regimen is ended. So really an effective product that can synchronize roughly 85 to 90% of gilts that are fed a protocol that's effective here and followed closely to be able to get them to come into heat. Another tool that we would have available would be one called OvuGel. So this one functions just a little bit differently. So this is a GnRH agonist. So triptorelin would be the active ingredient here, and this actually does initiate ovulation for gilts. So this can be used in certain situations in farms that want to be able to implement a fixed time insemination protocol. It initiates that LH surge that causes ovulation. really it's most effective, or studies have shown that it's most effective when it's administered really at that early onset of estrus, just because it more closely aligns with the natural hormone production of the female, and you're not trying to counteract or overpower any of the natural hormone state that female is going through at the time of administration. Immediately following an OvuGel, then a producer would go through and they would provide a single insemination 24 hours after OvuGel, and timing should be coincide with ovulation 24 hours or shortly after that female would be inseminated. So what about prostaglandins? If you're familiar in the beef world and synchronization protocols, prostaglandins are an effective way to be able to synchronize a group of heifers or cows. Not the case in pigs, though. So it can be used, in this case, luteolized can be used for induction of farrowing in sows, but it's not effective in synchronizing estrus cycles, as the CL really doesn't have prostaglandin receptors until about day 12 of their estrus cycle, in which case a female is naturally going to regress the CL with her own production of prostaglandins on day 14 to 16 anyway. So it really doesn't do an effective job of actually changing where that female would be at in her cycle, even with a well-timed shot. So in summary, we want to just be able to highlight that producers do have effective tools at their disposal for controlling the estrus cycle in gilts and sows, but just really reinstate that it's important to be able to follow the product label precisely in order to be able to maximize success. So with that, I'm Matt Romoser with Iowa State University, and thank you for listening.